Good day. Let's talk a little about lung fibrosis, which you may have heard about or you may have been diagnosed with. To understand lung fibrosis, look at the lung. This is the lung, as I've always described, two bags of air, sponge bags of air in our lung, and the airways, which you can see in red, which bring the air to the lungs. Now, the lung has this amazing function of gas exchange. That means that occurs in this sponge. And gas exchange occurs from the air that is brought in has to be taken to the blood. So that occurs through a very thin lining called the interstitium. And I will show you that in a quick second. Okay, here it goes. This is the interstitium. As you can see, normally the lining in the lung is normal and oxygen gets easily into the lung. But as this interstitium is so long that if you open out the entire lining, the area is as much as a tennis court. This interstitium can get swollen, which you call an inflamed interstitium. And this interstitium can also get scarred when you call it a fibrotic interstitium. Now, the important thing to understand is that in an inflamed interstitium, you can actually reduce the inflammation and thereby improve the gas exchange that was otherwise normally occurring, which is now reduced, with drugs like steroids and immune suppressant drugs. So if the interstitium is inflamed, and your doctor will tell you that, if your interstitium is fibrosed, then there is no drug to currently bring it back to normal. And so you have to give a medicine that will slow the progress of the fibrosis, which is an anti-fibrotic drug, pirfenidone or nintedanib. So this basic must be understood. In this situation, you can hope to gain something by reversing inflammation, but in this situation, you cannot reverse the fibrosis. You can only slow the progress, especially if it is progressing rapidly. And the drugs are pirfenidone, nintedanib, and these are steroids and immune suppressants. So this is the basics of lung fibrosis, and the most important test to understand how it's functioning is called the DLCO, which is done on a lung function machine. And otherwise, just a simple test like walking, and you notice your oxygen saturation is dropping on a pulse oximeter, tells you that your interstitium is not functioning normally. So that's a rough guide to that. Otherwise, you must ask your doctor what type of interstitial lung disease you have. Is it more inflammatory or more fibrotic? And if it's inflammatory, then take an immune suppressant drug under his advice and see if your lung function is actually improving. Then only you know objectively that therapy is working. If it's not working and serial CT scans are suggesting that you have progressive fibrosis, it's unlikely the immune suppressant drugs will help you. You will probably need to be on an anti-fibrotic, and you should discuss that with your doctor. Thank you.